Government is currently finalising its COVID-19 vaccine no-fault compensation scheme. Cooperative Governance Minister Nkosazana Dlamini-Zuma says the purpose of the fund is to provide quick and easy compensation should anyone suffer injury due to the vaccine. South Africa has secured enough doses to vaccinate 46 million people, but some agreements signed with pharmaceutical giants come with conditions. For more on how this fund will work, we're joined by the public health lawyer, Safura Abdul Karim. Safura, good evening, and thank you so much for your time. One of the things that makes this conversation around compensations, should one experience any difficulties with this vaccine, is that there hasn't been a great deal of transparency around what exactly is covered between those agreements that have taken place, signed by the country and the pharmaceuticals.
Good evening, Kathy, and thank you for having me on. I think you've hit the nail on the head. The entire regime of the no-fault compensation fund and the need for it arises precisely from these agreements that we have not had access to. And it is globally the case that these agreements between governments and pharmaceutical companies have been completely untransparent. And the fundamental reason behind that is that the companies are controlling access to vaccines, and so they can negotiate and demand whatever terms they want, including secrecy and non-disclosure agreements around the specific terms they negotiate with governments.
What we do know, based on what has been said publicly, is that it's taken a great deal of negotiation when it comes to these contracts, but it seems very much that there is a certain liability that the government has had to take on when it comes to whatever issues may arise should somebody experience complications that they believe are as a result of the vaccines.
That's correct. So at the moment, under certain agreements, the government has said that they will indemnify the vaccine manufacturer against any liability for adverse effects that are felt from a vaccine. Now, that some of the indemnity has been absolute, some of it has been partial, and the current regulations that were gazetted on, I believe it was the 20th of April, sort of leave that quite open. It's very much determined by the specific agreements that government has with the pharmaceutical companies. I will say that it's not entirely uncommon to have these types of indemnities and waivers built in to new technologies, particularly ones like the COVID-19 vaccine that have been developed under very short timelines. And because of the need to urgently roll these vaccines out and the fact that many of them are being subject to emergency use authorizations, there's a need to kind of compensate for the risk where a normal vaccine would have been tested over many years, and the risk would be lower for any adverse effects. So that is a contributing factor.
Are there specific conditions that government is currently looking at that would apply to those who want to be able to access this fund should the need arise? Of course, that should also always be emphasized.
So the details of the fund are not fully fleshed out in the regulations that were published. What we do know is that people who suffer very serious and significant side effects from certain COVID-19 vaccines will be able to claim from the fund. It's not clear which vaccines that covers, although we can probably take a guess that it was the Johnson & Johnson and the Pfizer, given that that's what government has been in negotiations over. The quantum or the amount that can be claimed is not clear. What I will say is that this fund does not stop individuals from approaching the courts and demanding damages through the court system or from suing government. What it does prevent you from doing is suing the manufacturers of the vaccine and suing any healthcare workers who were involved in administering the vaccine. So the only people you can sue for adverse effects related to a COVID-19 vaccine is government.
So people would be able to claim from the fund and still take on court action. So claiming from the fund doesn't preclude you from taking any kind of court action, despite the fact that you may have already received some kind of compensation.
That is correct. That is based on the current regulations that have been gazetted. The only qualifier is that you have to approach the fund, and if you've approached the fund for compensation, you have to wait for that process to be completed before you could pursue a court case. And the second caveat is if you pursue a court case and you receive an award from the fund, then the amount of money you get from the court case, you must deduct what you received from the fund. So you don't essentially get it twice, but you can get more than what the fund would award you if the court case is successful.
Of course, Safura, the one thing that government would be wanting to avoid is, you know, increasing cases and amounts of litigation due to what may arise should there be complications here. How much of a risk is that on the part of the state? Because we know already that a significant part of the budget, particularly in health, goes towards damages and lawsuits where people have really received bad care.
That's a big question. I think there are sort of two issues that will determine how big the liability potentially might be. The first is what types of serious or adverse events are covered, because that's really, you know, there aren't a huge number of adverse events per million doses of COVID vaccine administered. So the pool of potential litigants is a lot smaller than something, for example, like the Workers' Compensation Fund that operates under COIDA. The second factor that will limit liability is how the funding for this fund is raised. So if one thinks of the Road Accident Fund or the Workers' Compensation Fund, those funds are not directly funded by government, but are instead funded through levies or through fixed payments that employers make. It hasn't really been determined how this fund will operate. It's not like, you know, you're filling up a liter of petrol and a certain percentage or a certain number of cents from that liter go into the fund. So there is a question about how it's going to be funded. And I think if some of that funding comes through other channels, it can limit the impact on the budget. But you're very right. How, liability related to medical malpractice and adverse consequences from healthcare in the public sector take up an enormous amount of the budget. And that is funds that ultimately lead to the healthcare system being weakened, because that money isn't going to paying doctors and nurses. It's going to these litigation cases.
Let's leave it there for tonight. Safura Abdul Karim, she is a public health lawyer.